Welcome to Facts TV News, where everything is true. Seaview Gardens mother and son missing. Police in St. Andrew are seeking the public's assistance to find 40-year-old Kimisha Simit and her 11-year-old son Shamar Williams, both of Yellow Sea Drive, Seaview Gardens, Kingston 11, who have been missing since Sunday, February 7th. She is of brown complexion, stout built, and about 162 centimeters tall, while Shamar is of dark complexion, stout build, and about 132 centimeters tall. Reports are that Simit and her son were last seen at home about 1 p.m. Simit's mode of dress at the time she went missing was a blue skirt and pink t-shirt, while Shamar was wearing a blue short and white merino. All efforts to contact Simit have failed. Anyone knowing the whereabouts of Kimisha Simit and Shamar Williams is asked to contact the Seaview Gardens Police at 876-997-9372, Police 119 emergency number, or the nearest police station. Manchester woman killed in crash identified. Police have released the identity of an elderly woman who was yesterday killed in a motor vehicle accident on the Greenvale Main Road in Mandeville. Deceased is Ina Wisely of Rick Ward District, Huntley in the parish. She is believed to be in her 60s. The police say that about midday, Whiteley was a passenger in a Toyota Probox public passengers vehicle traveling on the Greenvale Main Road when the driver attempted to overtake a truck. The driver lost control of the vehicle and slammed into a median. The occupants of the car were taken to hospital where Wisely was pronounced dead. 4 other passengers were treated and released. The driver is said to have been admitted. Mayor says COVID-19 spike has pushed Manchester to crisis. Mayor of Mandeville and chairman for the Manchester Municipal Corporation Donovan Mitchell says the parish is approaching a crisis as it recorded the highest number of new coronavirus cases in the 24-hour period on Monday. I just looked and saw the numbers of beds left at the Mandeville Regional Hospital. If you have 81 cases yesterday Monday, we don't know what today's number will be and the days to come, so you could end up in a crisis situation, he said. A senior health official said yesterday that of the 20 beds on the isolation ward at the hospital, 13 were occupied. The source said the bed occupancy averages 70%, with some patients recovering. But Mitchell said he was not surprised at the rate of increase in cases because people are just not observing the protocols. When you look at the banks and you look into the markets, these people are not wearing their mask. The amount of people that are outside these banks in line is one of the major concerns. But the mere fact that people are not wearing masks and keeping the social distance is our major problem, he added. Mitchell pointed to continued breaches of the Disaster Risk Management Act, DRMA. There are still a lot of parties going on all over the parish from time to time. People are posting things and posting pictures of parties being held without permission. One of the things the police would have to do in this time is to come off the main roads and go onto the community roads because that is where you have the get-together and cookouts, he said. Head of the Manchester Police Superintendent Gary Francis said that the police will continue to enforce the DRMA across the parish. Mitchell, meanwhile, is urging residents of the parish to only leave their homes when necessary. If you don't have to come out of your house, just stay home. You don't have to come into the town to just sit down and idle, like I see happening in some places. As a people, we have to be careful, he said. Manchester has been under tighter curfew measures over the last 2 weeks due to the spike in COVID cases. The 7 o'clock curfew had worked well. I think we need to tighten up on the social gathering wherever they are, the mayor added. Prime Minister Andrew Holness yesterday in the House of Representatives announced revised curfew hours 8 p.m. to 5 a.m. as of today for 2 weeks. The Kendall camp, which had been used by the Southern Regional Health Authority, SRHA, as an isolation facility for recovering COVID patients was up to press time yesterday vacant. Based on the size of that building, I think that would be appropriate at this time, Mitchell said. Member of Parliament for Manchester North Western, Michael Phillips, said he is in support of a field hospital for the region, Clarendon, Manchester and St. Elizabeth. It is sad that after all the measures and the attempts that have been made by only the authorities, the political representatives and certain community leaders in sort of mitigating the spread of the virus, that we have found Manchester in this position, he stressed. At the parties, the grave diggings and funerals, even though they are not held in churches, you see large crowds at the graveside. We find that not only in Manchester, but right across the country, that people are not observing COVID protocols. Something that is glaring is that, even though you have the curfew, COVID keep in the day too. If you look at the town centers, it is as if there is no observance of any COVID guidelines, he added. I also have concern for those school children who have to be traveling for miles, taking more than one transportation. In rural areas, we tend to depend more on the route taxis. We don't have a school bus system operating at this time. Our students and teachers are greatly exposed at this point in the time, seeing the rise of cases in the parish, he added. He claimed that there has been a relaxing of hygiene measures. At the start of the virus, when we started identifying cases here, people were vigilant. They were taking off their shoes before going inside, washing their hands before going into their homes. And now we are behaving as if COVID not keeping anymore. The rise in the number is showing that it is even getting worse, Phillips said. Please remember to subscribe, like, share, and click the notification bell for daily updates.